Our group project is over low intensity activity in the ICU patients, performed by Alicia Davis, Randy Redwine, and Anna Davis.
The letters ICU stands for Intensive Care Unit.
My article was over comparison of exercise intensity during 4 early rehabilitation techniques in sedated and ventilated patients in ICU, a randomized crossover trial. Early rehabilitation in intensive care has been shown to have many benefits. Despite early rehabilitations, 1 and 2, which is 52% of the patients develop ICU acquired weaknesses. These contrasting are likely due to the fact that most bed exercises are low intensity. Late rehabilitation studies have not found intensive rehabilitation to be more effective than standardized rehabilitation. Exercise that can be carried out early in the ICU are usually low intensity since the patient usually remains in bed. The aim of exercise is to increase or maintain muscle strength and cardiovascular function. One method of evaluating the exercise intensity is to measure cardiovascular parameters and muscle oxygenation. The 4 most commonly used types of bed exercises are passive range of motion for the legs, passive cycle ergometry, quadricep electrical stimulation, and functional electrical stimulation coupled with cycling. The main aim of this study was to compare changes in cardiac output during the 4 most common types of bed exercises in intubated, sedated patients confined to bed in the ICU in order to determine which exercises had the highest intensity. The secondary aim were to evaluate right heart function and pulmonary and systemic artery pressures during the exercises and the microcirculation of the vastus lataris muscles. In my article, I'm going to list the inclusion and exclusion criteria for the research method. Inclusion criteria were that patients must be over 18 years of age, intubated for at least 24 hours, and ventilated with pressure support. To avoid changes in cardiac output related to other factors such as pain, stress, or etc., only sedated patients with a Ramsey score greater than 4 were included. For the exclusion criteria, patients were excluded if they had a pacemaker or other contradiction to electrical stimulation, if they were ventilated under assist control ventilation, or were conscious. The procedure and randomization of the patients. All patients participated in 4 consecutive 10-minute sessions of bed exercises. It was 10 minutes of PROM, which is the passive range of motion. You had 10 minutes of the quadriceps electrical stimulation. You had 10 minutes of the passive cycle ergometry and 10 minutes of the functional electrical stimulation cycling. For the in-bed cycle ergometry, or the passive pedaling and the functional electrical stimulation cycling, the pedaling frequency was set for 20-minute revolutions per minute. For the exercise involving quadricep electrical stimulation, a rectangular bidirectional current with no ramp was used, and the intensity was modulated to obtain a palpable muscle contraction. As the method goes, this was a randomized controlled crossover study carried out in an 18-bed ICU between November 2016 and July 2017. The study was approved by the Institutional Revision Board. Written, informed consent to participate in the study was required from all patients. When consent was given by proxy, the patient was informed as soon as possible and written consent was obtained. 21 patients were included. One patient was excluded from the analysis because only 2 of the 4 interventions were carried out because the ultrasound machine was needed for an emergency in another patient. So that resulted in only 19 patients with the results. As for the conclusion of my article, cardiorespiratory response to exercise. The principle of physical exercise is to increase muscle work in order to increase metabolic energy demand. The increase in muscle activity leads to an increase in metabolic consumption of O2, oxygen, and cardiac output in order to maintain muscle perfusion and sufficient levels of O2. Of the 4 interventions, only functional electrical stimulation cycling increased cardiac output. Evaluation of the main intervention used for early rehabilitation in the ICU showed that only functional electrical stimulation cycling increased cardiac output and produced sufficient intensity of muscle work to constitute an effective early rehabilitation intervention. Also, longer-term studies of the effect of functional electrical stimulation cycling for preventing muscle atrophy or improving functional outcome should be carried out.
For my current evidence-based article, I used measurement of physical activity levels in the ICU and functional outcomes. So in this article, it talked about the number of patients that were being recruited, when they were being recruited, the age limit that they needed to meet, and one of the measurements that they used was the motion sensory that was placed on the mid upper arm to measure their movements. In the research, the patient was instructed to remain in the hospital for 48 hours for at least 5 days. While being in the hospital, they needed to wear that monitor armband to determine the different kind of settings and movements that they were going to be doing in physical therapy. For those that were up and not asleep, they were able to do the physical therapy. And the physical therapy didn't last that long. It would last for about 15 to 20 minutes. And they would do it twice a day. And it was up to the patient if they wanted to do it the second go round during the day. The types of exercises that the doctors or the physicians would perform on the patients would be sitting on the edge of the bed, PROM, which stands for passive range of motion, transferring them out of the bed and mobilizing them, or they'll have an exercise prescription using a tilt table. In conclusion, for my article, the first 5 days while the patients were in ICU, their intensity levels were low, but as they progressed day after day, the intensity began to rise. And motion sensor technology in the ICU was for the safetiness and feasible for the patients. In the next 3 slides, we provided a couple of different phases of exercise that is done in the ICU recovery